Hi, welcome back to Christine's Health Affairs. I'm trying to get motivated to do some sewing today, and I thought I'd give you a quick update because it's been a really long time since I've given you one. I had the MRI a few weeks ago and I got the results back for that. I finished my radiation treatment 15 days ago and I've started my capecitabine. I'm not sure if that's the correct way to pronounce it, but they're my chemo tablets. Today's Thursday. I started those tablets on Monday. So the MRI results came back with interesting results. They wanted to check my pituitary gland because of the cortisol or the adrenal failure that I had some months back. And everything's fine there. So they didn't find a tumour in the pituitary gland, which they didn't expect to, and I didn't expect to either. But they did find something else. And what they found was right inside the brain in a void. And we jokingly say I've got plenty of voids inside my brain. And at the moment it feels like I do because I've got such brain fog and can't remember anything. It's just getting ridiculous. But inside the centre of the brain, if you go right down inside, there's a void, and I think it's got to do with it connecting to your spinal cord and your brain fluid and all sorts of other things. But there's a thing called a dermoid cyst. And a dermoid cyst forms in the person's brain at 2 to 3 weeks, at the 2 to 3 week stage of an embryo. So it's been in there my entire life before I even existed, and it's just been sitting there. It's about 1.5 to 2 centimetres in size, so it's benign, so I'm not really concerned about it. And I kind of did a little bit of research, went down this really, really deep rabbit hole and decided, and it's not true, I'm just making this up, I decided that I have a Siamese twin or a conjoined twin or something up there. I've called him Bruce. So look, I'm just making light of it. I don't know if it's a problem at all, but my oncologist has sent me off to a neurologist. So sometime in November I do have an appointment with a neurologist, and he will assess it then and determine what needs to be done, if anything. It may just be that I need to have another MRI at some stage just to make sure that Bruce doesn't grow any further. Apparently it's an incredibly slow growing cyst. So I'm not going to worry about it. So yeah, it's just there. Anyway, that's the MRI and those results over and done with. My radiation therapy went really well. I finished that 2 weeks and 1 day ago. And this period now is when I'm supposed to probably feel my worst after radiation therapy. So the fatigue and the severe burns kind of catch up on you at this stage. So I started my new chemo tablets on Monday, and I started feeling tired, or I was feeling more tired or fatigued pretty much straight away. And I'd forgotten all about radiation therapy and thought, geez, that's quick for these tablets to start making me tired. But we had an appointment with a radiation oncologist yesterday, and I've realised that the tiredness that I'm feeling at the moment is the effects from the radiation. So it's at the peak time now for these effects to be hitting me. I am extremely brown under the arm here. I probably look like a really dark brown tree trunk under there, and my breast is quite dark as well. Normally if I go out in the sun I tan quite quickly, so I didn't get too much bright redness, but it is extremely brown, tender, itchy, prickly, all of those things. But all of that's on the mend now. I didn't have any peeling or blistering, which was really good. And now I just have to wait for the fatigue to try and subside a bit. So I've been too tired to do any videos, even just my sewing videos. It's I get up in the morning and all I want to do is lay down and go straight back to sleep again. I've managed to go for walks with Chris and the dog twice a day, so they're really short walks. I haven't really had the energy to go all the way to the lake yet. Haven't done that since, well, I've done it once since the beginning of the year. But Chris and I have started to get me back training for table tennis. I was hoping that I'd be able to start to play in the spring comp, which starts next week, but I'm just dreaming. We were also going to go to rock and roll dancing on Tuesday night, and I just didn't have the energy for that. But we'll play it by ear and see what I can do. I've managed to get my training schedule up to 15 minutes for table tennis, but sometimes I just fall in a heap and get really upset because I can't do much. But I'm getting there. It'll just take a while. It'll just take a little while, and I've just got to learn to be a little bit more patient with myself. The chemo tablets I started on Monday. They have so many side effects that I'm hoping not to get them. We did actually go and see the oncologist in Melbourne on last week, on Wednesday, and she's quite concerned about the side effects that I might possibly have, given that I had so much trouble with immunotherapy and other things along my journey. But we jokingly said to her that we're more concerned about how she's going to feel when all of these things happen, if they happen. They're not going to. So, yeah, there are quite a lot of side effects with this new chemo drug. I'm taking 4 tablets in the morning, 4 tablets in the evening. I think it works out 2,000 milligrams in the morning and 2,000 in the afternoon, and I do 2 weeks on, 1 week off, 2 weeks on, 1 week off, and I repeat this cycle 6 times. So it's over 18 weeks that I've got to take these chemo tablets. After all of that, I'll be completely finished, hopefully. So one of the most serious side effects, I guess, is a thing called hand and foot syndrome. Your hands start to go red, and your feet, and they can get blistery and start peeling. My hands are starting to go a little bit red, and my feet were tingly last night for quite some time. It's not the neuropathy that I still have, so I've just got to keep an eye out on that. And if that does happen, all they're going to do is reduce the medication that I am taking. Apparently, I'll still be doing the full course. I just won't take the full dosage if I have any issues. And then there's lots of other side effects, but we don't plan on having any of those affect me this time around. I shouldn't lose my hair. It's looking really nice. I just play with it all the time, and for some reason I've got this natural side part. I don't do it on purpose. It's just parting on the side, because when it was long it was always in the middle. But yeah, I'm really liking the new hair growth. It's driving me nuts having to maintain it. So I was really lazy with long hair. All I had to do was wash it, brush it, leave it. That's it. Now I have to wash it every morning or wet it every morning because I've got spiky bits all over the place. But I guess that's a small problem to have. At least I've got hair, right? What else is there? Don't think there's much else. The radiation oncologist explained to us yesterday that going forward, once I finished these chemo tablets, I'll be mostly dealing with my breast surgeon. She's the one that will organise any appointments or any scans that I need to have. And I'll also be working with my oncologist for the next 5 or 10 years or so. The crucial time for cancers returning is probably the first 2 years, possibly in the first 5 years, but the first 2 years is when the highest recurrence rate apparently is. And I'll be monitored with mammograms in both breasts, and also having my lymph nodes checked via ultrasound as well, and that's how they will determine whether or not a cancer has returned or travelled to other parts of the body. And if that's the case, then I might have a PET scan and have the entire body checked out. So for the next several years, all I'll need to do is have a mammogram and an ultrasound, and if anything is found in the lymph nodes, then they'll explore further. So he's hoping none of that is going to happen, and also hoping that none of these side effects are going to happen from these chemo tablets. I'd really like to get my energy levels back and just live a nice, normal, quiet life. Anyway, I am going to love you and leave you. I've got so much sewing I need to get done. My sewing room's an absolute pigsty, and I've really got to get some things done. So cancer's tough, but we're tougher. We're nearly at the end, and I shall see you next time. Bye for now.